Well, if your springtime allergies are kicking in already and your over-the-counter meds aren't working too well, we have some new options for you. We headed out recently to Allergy Asthma Associates to learn more.
We've been waiting all winter to play outside, but with this springtime weather comes pollen.
At this time of year, it's outdoor pollens that are causing people the most misery. So what you want to make sure is that those outdoor pollens don't become indoor pollens. Make sure you keep your windows closed, keep your doors closed. If you've been outside for a prolonged length of time, consider changing your clothes or rinsing off. Likewise, if you have pets that stay outside for a long time, give them a good brush or a wipe down perhaps when they come inside the house.
The Allergy, Asthma, and Sinus Center is the largest allergy practice in the state of Tennessee.
We stretch from Johnson City to Middle Tennessee, and we've got 9 locations in Middle Tennessee, 4 board-certified allergists to treat all adult, pediatric, and adolescent allergy and asthma problems. A board-certified allergist has specialized training in the diagnosis and management of allergic disorders. We all do a primary specialty, whether it's internal medicine or pediatrics, and then go on to do additional training in allergy, usually 2 or 3 years, focusing on just those specific problems. You should see a good response to over-the-counter medications fairly quickly. So if you've used them for a few days and you're not getting adequate symptom control, then it's time to see your doctor and see what other options there are for you.
And because everyone's allergies are different, the board-certified allergist will provide you with a personalized treatment plan.
So the first thing we do is take a good history and do a good physical examination. And often that will give us an idea of whether people are or are not allergic, or perhaps what they're allergic to. But the one way to really figure that out is to do allergy testing. Allergy shots have been around in America for 100 years, and they're done a little differently now than they were, but the general idea is the same. They have the most history behind them. They're FDA approved for use in the US, and as best we can tell, are the most effective form of immunotherapy. Allergy testing involves taking a little plastic toothpick that sits inside a well that contains the allergen. We sort of dot the stuff on the back and see if anything reacts. There's a new grass tablet out. It works just for pasture grasses, so not for southern warm weather grasses like Bermuda and Bahia, and doesn't work for other forms of allergy like tree pollen or ragweed or dust mites. It's been shown to be effective when used for about 12 weeks pre-seasonally and then during the season, so you have to take it for several months out of the year to achieve control during the grass pollen season, but it does appear to be effective and safe to use at home. Pollen levels tend to be highest in the early morning hours, so if you can avoid prolonged outdoor exposure in the mornings, perhaps if you're an exerciser, try to switch that to the afternoon. That will reduce a little bit the level of pollen exposure that you have. But the honest truth is, morning, noon, night, it doesn't really matter. In Middle Tennessee in the springtime, there's going to be lots of tree pollen outdoors.
The Allergy, Asthma, and Sinus Center has many locations right here in our area. To schedule an appointment, give them a call at 866-231-0701. You can also head to allergyasc.com.